The World Health Organization has designated the decade 2020 to 2030 as the decade of healthy aging. So this then is a spur for institutions to really lift their game in terms of, are they embracing age-friendly initiatives and endeavors. The University of Queensland became the first age-friendly university in the Southern Hemisphere in 2020. So being an age-friendly university, it means adopting a set of principles, but the overarching principle is that aging brings dividends, not simply burden. And so across the many missions of the university, in teaching and research and outreach to other organizations, we really underscore the fact that we're looking not only to promote the value, but to try to assist those who are aging to live their best possible lives, to reach the goals that they have. So this includes really looking to how we can minimize ageism and ageist thinking within the university, how we can encourage mature age students to come back to university and study, whether it's a second career or maybe going off in a new direction, gaining new skills. We would really like to boost our research, and we have some excellent research at UQ looking at various aspects of aging. For longer than a decade, it's been known that despite an increasing percentage of people being older, the number of people being trained to treat older people within various healthcare disciplines, physicians, nurses, allied health, has lagged way behind. And so there's this gap in what will be required in terms of the demographic change. So UQ is really committed to trying to expand the number of placements that students have, where they can interact with older people, and also strengthening our links to the local health centers. Brisbane Diamantina Health Partners, which UQ is a part of, has been really supportive of our aging theme within that, to try to really showcase cutting-edge research and also highlight early career researchers and research clinicians. Part of being age-friendly in terms of the university is part of being a part of the larger age-friendly ecosystem. And so that would include age-friendly cities and communities, age-friendly universities, age-friendly healthcare centers, and age-friendly public health initiatives. So this then is a holistic approach to how we can really make an age-friendly society.
It's very important that we start thinking about age-friendly hospitals, because older people are the biggest users of hospitals. You're much more likely to need hospital care as you become older because we accumulate more diseases, but also you're more likely to be vulnerable to hospital-associated harms. And some of that is because the care models and the care teams and the care environments that we have in hospitals were not ever designed really with older people in mind. We really designed hospitals for acute episodes of care in younger and middle-aged adults. And that just means that we've gotten behind in how we start to look after people in an evidence-based way. And then underlying all of that, we're institutions, same as all the other institutions in our society, that are fundamentally ageist. And so older people tend to be invisible in our systems, and we don't really bring their voice into improving our systems of care. The World Health Organization has just released a global report on ageism, and it's really quite damning in it that it shows from tens of thousands of interviews with people across many countries that around 50% of people are ageist. And ageism is a very interesting form of prejudice and discrimination, because it's actually discrimination against our future selves. And there is still an emerging evidence base about how we might try to tackle ageism within our institutions, so within hospitals, for example, or within universities, but also at that broader societal level. The Brisbane Diamantina Health Partners funded a qualitative study that we've just had published this year, looking at what it is that creates the gaps in being able to provide age-friendly care, because most people agree it's a great idea, but actually doing it is difficult. And really what we found is that the things that are required to support age-friendly hospital care is empowering the leaders who are close to the action. Investing, as the state government has done, in some of these evidence-based care models. Investing in skilled teamwork, so not just people who have knowledge about how to care for older people, but people who can work really well as a team. Fundamentally underpinning all of those, we actually have to care as a society about how we care for older people. The program that I lead is called the Eat, Walk, Engage program, and that really works with individual wards to try to look at what we're doing really well around older person friendly care and where there's room for improvement. And there are some really important features of the program. Firstly, we always start by talking to older patients on the ward about what their experience is like. What do they think? What are they finding are barriers to the things that we would call fundamental cares? So getting up and mobile early is really important to functional recovery. Having meaningful social and cognitive activities is really important to prevent delirium, and getting adequate nutrition and hydration is very important to maintaining your strength. So how do we make sure that those apparently simple things get delivered in a really consistent manner to all of the patients on our ward in a system that is always strapped for time and there are always competing priorities? Our program began at the Royal Brisbane Hospital, and it's shown some really great results in a large trial that we did across four Queensland hospitals with almost a 50% reduction in delirium, which is a very important complication in hospital. And as a result of that, we've been supported by the state government as part of a fantastic investment in improving care of older people in hospital called the Frail Older Persons Collaborative. We're now in 20 hospitals across Queensland and working actively with the clinical leads and the clinicians really to start to embed a lot of these principles. And I think Nancy already talked about the challenges in educating our health professionals and how far that's lagged behind. So we've got a lot of training to do on the wards. We've got a lot of work to do to really get teams working together and working towards how we might improve our environment. This is really the largest scale initiative that I know of around Australia, and I know the other jurisdictions are watching with a great deal of interest. We're hoping to do a large evaluation of the program as a whole, really to see what impact it's had on older people's experience and on clinicians' experience, but also what aspects have been easy to implement and sustain and what might be adopted by other jurisdictions around Australia. You know, our dream is really to be providing age-friendly hospitals right throughout the country.